I'm a nurse, and my name is Ewing. I'm actually speaking for one of my coworkers, Lori Furland, who's a registered nurse. She's been doing maternal child health for the last 39 years. She actually prepared this testimony, but due to a family emergency, she's not able to be here. Lori writes, I'm deeply concerned about cuts to our state's Medicaid program. While I understand the need to eliminate unnecessary spending, we need to keep our mind on the underprivileged and the poorest of our population. It's not pleasant to be poor, to wonder whether or not one will eat today, or have enough heat to heat one's house, or even have a house to live in. She says, I know this because I lived it. Just recently, our hospital announced that as of early April, we will no longer offer LeVan, which is a transportation system for patients who have no other way to get to their medical appointments. In fairness, the hospital has said that they are looking for alternatives, but to date, we have heard nothing. Just yesterday, I had a doctor come to me about a pregnant patient she was seeing. The doctor stated that the patient was at very high risk for gestational diabetes, but the patient had missed 2 critical appointments for testing due to transportation issues. This is a delay of over 5 weeks in getting the care this patient needs. Fortunately, the LeVan is still operating, and we were able to arrange testing for her this Friday. If this patient does have gestational diabetes, she will be transferred to a high-risk service for the remainder of her pregnancy. But how will she get to her appointments if she has no transportation? Without the proper care, this baby could be born compromised and require a stay in the NICU, which could cost, I don't know, $50,000 to $75,000 per week, she hears. And that depends on the severity of the illness. Also to be considered are the long-term effects for this family and this baby. Sick, distressed infants have more postnatal problems, some of which can be lifelong. These can be developmental delays and/or cognitive impairments. This, in the long run, will contribute to high costs to our Medicaid system. So if prevention can help avoid these complications and their costs, then access to good prenatal and postnatal care is the most cost-effective solution. Stopping transportation to vital medical care for our state's most needy is not the right thing to do, and it will not save money for the state of Rhode Island. Lastly, Lori writes, I'm concerned about our administration. They are currently laying off important staff even before the new round of Medicaid cuts. Providing care for our patients, as Lou said, is getting harder and harder under these conditions. How much worse will it be if they cut further? If you're looking to find savings, I just suggest start at the top. Thank you.